Now, sa meridian theory, part 7, diagnosing via the channel, number 2. Sa palpation, we have the process of running one fingers along the course of the channel. So we have to touch the skin of the patient. Most often, this involves palpating the channel pathways below the elbow and knees. So kailangan po natin alam ang channel pathway ng mga points. So usually ginagamit natin yung elbow and knees as discussed in chapter 13 of the Classic of Difficulties. The practitioner should first grasp the patient's hand or foot with the right hand and use the thumb. So yung right hand po yung hawak ng paa and yung thumb naman ng left hand to palpate the lower aspect of the channels. Palpation should follow the course of each of the 12 regular channels from the hands and feet proximally towards the elbow. So from the feet, paakyat po yung pagpalpate. Kung sa hands, from the hands, papunta ng elbow. And kung sa legs naman, from the foot, papunta ng knee. As one's left hand moves up towards the elbow and knees, right hand grip might move to the wrist and ankle. So, ganun din po, i-grip natin yung wrist or yung ankle. Especially at first, the practitioner should palpate the channel 3 times. Pressing a bit. So, unahin po, mag-press ng konti. A bit harder each time to feel for deeper and deeper changes. So, ramdamin po natin palalim ng palalim. Some changes may be very clear at the surface but may not be palpable when pressing harder. So, be very careful tayo pag-palpate. Simulan natin sa surface, then palalim. Yung one na hinahanap natin na kailangan ma-palpate kung may changes dun sa surfaces, kung may hard, may soft na papalpate po tayo. The goal is to discern structural changes along the course of the channel, which includes not only changes in muscle tension, but also yung nodules, yung bumpiness, or kung may granularity tayong napapalpate. The types of changes that one might find are categorized below. So we have the illustration here. Yung straight line is the symptoms and yung putol na line are the palpated channel changes. So kailangan po kunin natin yung history kung ano pong mga symptoms ng patient and i-match po natin siya dun sa through palpation. Channel changes occur in a similar timeline with symptoms presentation. This is the most common occurrence. So sumasabay lang po sa timeline ang symptoms and changes. So we have here ang illustration. Kung napapansin niyo po, yung right hand nakagrasp po dun sa may dulo ng paa. Then yung left hand naman po siya yung nagpapalpate ng directions using the thumb. The practitioner should grasp the fingers or toes with the right hand when palpating the most distal aspect of the channel so as to tighten the skin. This facilitates feeling small changes in this area. Later, as the left thumb goes up towards the elbow and knees, the right hand grip might shift to the wrist and ankle. So habang pataas naman, yung right hand natin, paakyat din, pwedeng hawakan na dun sa may mismong ankle or pwedeng dun sa may wrist ng patient. The idea is to keep both hands in contact with the patient. So we have, pwede nating isang gagawin is by pressing, which involves the use of the thumb or finger to check the tenderness along certain areas of the channel. So using the thumb or yung fingertip, alamin natin kung merong tenderness dun po sa area ng channel. Or more commonly, at a particular point. So, tatanungin natin ang pasyente kung meron siyang nararamdaman na masakit. When pressing an area, more severe pain may indicate an accumulation of pathogenic qi. So, pag nag-signify ang patient, there is pain on that area, ibig sabihin, merong pathogenic qi na present. While a weak and soft feeling with or without tenderness, it indicates naman that there is qi stagnation in the channel. So, when there is presence of qi stagnation, ang mapapalpate is weak and soft feeling by the practitioner. Tenderness of pain is indicative of an excessive condition. So, when there is presence of excess condition, ang mararamdaman is presence of pain or tenderness, often involving heat or fire. The more slippery hard the sensation beneath the fingers, the more it tends toward phlegm naman. So, presence ng phlegm, ang mapapalpate, slippery hard sensation. The technique of pressing on points is sometimes used to determine proper location as well. So, kung lulocate natin, isa din po itong ginagamit natin to press on points. When searching an area for the precise location of an acupuncture point, it is often helpful to look for tenderness or pain. So, ito po yung ginagamit natin sa point location din. However, it should be noted that a lack of tenderness at the point does not rule out that point for the treatment. Especially in cases of deficiency, the fact that the area around a point is not tender should not disqualify it. So, hindi naman ibig sabihin na wala pong presence ng pain, hindi po yun yung point natin na gagamitin. Furthermore, there is a difference between normal tenderness, which many patients will report, and the type of tenderness associated with channel diagnosis. When the practitioner suspects that tenderness has diagnostic significance, it is important to compare the tenderness at that point with tenderness felt in an area nearby. So kung may naramdaman pong presence ng tenderness, i-compare po natin dun sa area nearby on that particular tenderness. If the change is diagnostically significant, there will be noticeably more tenderness at that point than there is nearby. So, compare po natin sa nearby area, kumpara po dun sa nagsabi po ang pasyente na tender po yung napalpate natin. So, dito sa table, yung sensation when pressing and the possible diagnostic significance. Ang sensation na weak and or slippery soft, ang significance niya, there is lack of qi movement in the channel. So, ito po pwedeng cause maybe excess or deficiency. Ang sensation naman ng slippery hard sensation, ang significance pwedeng the harder, more fixed the sensation, the more likely the phlegm is in channel and or organ. Sa sensation ng tenderness with pressure, ibig sabihin, there is excess condition in channel and or organ, often naman caused by heat. Sa sensation na more severe pain with pressure, ibig sabihin, there is rising accumulation of pathogenic qi, maybe heat or cold. So, yan po yung significance of common findings sa pressing points and channels.